Do you have a history of smoking, high cholesterol, blood pressure, obesity, and diabetes? Participate in physical activities or dieting? Are you also under a lot of stress? You could be at risk of heart disease. Smoking leads to heart diseases and also harms every organ in your body. It contribute to inflammation, causing plaque to build up in your arteries, disturb heart rhythms, increase blood pressure and heart rate, thickening your blood, making it harder for blood to carry oxygen, and many more. If you care about your health, it is best that you quit smoking. It can reduce the risk of having a heart attack and heart failure. You can start by gradually decreasing the amount of cigarettes you smoke a day and be consistent. Although cholesterol helps your body build new cells, nerves, and produce hormones, too much of it can be a risk of heart diseases. Cholesterol in your bloodstream can form plaque and damage artery walls. This can cause atherosclerosis, meaning that the arteries are narrow and blood flow to the heart is blocked. You can prevent this by eating healthy, controlling your weight, and exercising. High blood pressure, also known as hypertension, is a condition in which the force of blood against the artery walls are too high. This can be a risk factor for a heart disease known as atherosclerosis. You can prevent this by exercising, eating healthy, managing stress, and using a blood pressure monitor. People who are obese are at a serious risk of a heart disease. Obesity is associated with an increased risk of developing cardiovascular disease such as heart failure and coronary heart disease. Being overweight can cause high or low cholesterol, high blood pressure, diabetes, and more, and they are all factors of heart disease. This can also be prevented by keeping your weight under control and eating right. Physical inactivity is an established risk factor for cardiovascular diseases. It is known that being active can reduce a lot of risk factors that causes heart diseases. It is important to remain active physically so that you can prevent risk factors of heart diseases. Dieting is an important risk factor in coronary heart disease. Food-related risk factors include obesity, high blood pressure, diabetes, and a diet high in saturated fats. A low saturated fat, high fiber, high plant food diet can substantially reduce the risk of developing heart diseases. Having stress can also lead to heart diseases because it could be chronic stress exposing your body to unhealthy, persistently elevated levels of stress hormones like adrenaline and cortisol. The risk of heart disease can be reduced by managing your stress. You can do this by eating healthy, working out, and if you have problems, please talk to a therapist. There are a lot of things that can cause heart disease, but there are also ways to prevent it. The choice is yours.